confirm that somebody has a low sperm count, usually we have to examine in the hospital. We have to examine their sperms, and so we have the laboratory person will show us that the sperm count is low, and you will see something similar to this actually. Yeah, these are nice. Okay, so over here, this is how a normal population of the sperms will be like. I hope it appears. So you find them crowded, and usually when they give the report, it's about 15 million or so.
That is released during the...
Yes, yeah, so they get the fluid which the man releases and they analyze, and they find the density of the sperms, that is the concentration of the sperms. They count the sperms per mil, and that's what we usually report. So about 15 million per mil is normal, and on the image in the microscope, this is how it appears.
Okay.
But on the other side, you find people have few sperms. This is how it will appear. They will be spread all out, and it will be obvious.
Okay.
So now when the sperms are few, you know, for pregnancy to occur, these sperms have to travel a long journey. They have to go all the way from cervix to the uterus, and then to meet the egg in the tube. It's a long journey, and on the way we lose a lot of the sperms. And so you need many to be able to have a few reach the site of fertilization. Otherwise, if you start with a few like this, none will reach the other side. Many perish on the way. Okay. So it's important, the sperm count for us. Other parameters related to the sperm also are examined. For example, the sperms have to have a certain shape of the head, the tail, for it to move in that journey. All that is examined. So the problem could be in the sperm.
Okay.
Yep.
Thank you so much, Doctor.
Yep.
I wanted kindly to have a small illustration of the blocked tubes, so that we see exactly...
Okay, the tubal problem.
Yes, the tubal problem, yes. Where it lies, which side is always blocked.
So maybe we look at, so to test the tube, the commonest test is what we call hysterosalpingogram. Now this is an X-ray test specifically meant for the tube. So what happens is the tubes and the uterus, they don't have bones, so the X-ray cannot see them. Okay. And so for the X-ray to see them very well, we must put in some contrast. So we put in liquid which the X-ray can see through the cervix, through the womb, and it flows into the tubes. And then we take images. Now those images are read by the doctor, and then he's able to interpret. Okay. So maybe we can first look at the normal one. The normal tube. Let's have the image for the normal tube. Yes, so here it is. Yes, so when the contrast is pushed in, it flows. This white stuff you're seeing here is the contrast medium which is flowing into the uterus, and then spills over through the tubes, and then you find it pouring free. You find it coming out, which means here the womb is open. Otherwise, the womb will not allow this to pass through. Means the tubes are open. That's why they are filling up. And that means they are open right at the end, so that's why it's pouring out. So this is how the normal one looks like. You can go through this womb, then you see the tubes appearing like a thread, and then you see things pouring out like water out here. This is a normal one. Now, on the other hand, if you compare with the abnormal one, let's have a look at it. Now you see here, this is down. Look at this. This is the uterus now. One of the tubes is beginning to appear, and it has some nodes though, but it stops right here, completely different from what was in the other one. Something is showing up here, it stops just here. So you don't have the other parts of the tube showing.
Part flowing down.
Yes, so all this part is not showing. So this is tubes blocked on both sides, what they call the bilateral blockage of the tube. So this person definitely has a problem with the tube.
With her tubes.
Yes.
So it becomes very hard for her to conceive.
Yes, because for you to conceive, the sperm has to pass through here and swim out through here and meet the egg around here. So that fertilization occurs, and then the baby, after fertilization, we call it embryo, has to be brought back and attaches in the womb.
Settles in the middle.
So all this movement requires the passage to be open. But also the tube should have the mechanism which helps to move those things.
Helps the things
should
to
be
move
working.
and allow them.
So some of those mechanisms are the ones which sometimes, in some cases where the tubes are open on this test, you find somebody can still not conceive. And yet there's an issue with the tube. That in such a case, the problem is that the infection, for example, chlamydia, it destroys the small tiny hairs which beat to move the egg. The egg does not have its tail. It's unlike the sperm.
Unlike
the sperm has a tail. The egg has no tail. So it has to be moved by that, like how food goes through the intestine. So if that mechanism is destroyed by infection like chlamydia,
the egg does not move at all.
Yeah.
Thanks so much, Doctor.
Yeah. That's why even in situations, some people ask this question that they have done all the tests on me. My tubes are open.
I'm normal,
but
things are
I'm not conceiving.
Okay.
You find that is sometimes the case.
That thing is missing, the hair to push.
Yes, and that is difficult to usually test. But now, currently, there are some tests showing up which are
moving around.
Yes.
Thanks so much, Doctor, for that very wonderful illustration. We are talking about the basics of infertility. To all the parents outside there watching, I had Doctor talking about mumps. We need to take mumps. Was it mumps, Doctor?
Yes,
mumps. We should take it very, very seriously because in the end, at times we just give children these herbals. We say it is just an infection, maybe it's fever. We give them Panadol, little knowing that the infection can really disturb the child in future. So we need to be very keen. And then to the ladies outside there, infections, if you are sick or you've contracted any STI, please don't wait when it's too long. You know, the effect can be so diverse that it affects you in future and it becomes very hard for you to control it. Thanks so much, Doctor, for that excellent explanation.